Hi, it's Kat at Orion Billing. Today I'm going to talk about the Medicare rules for healthcare practitioners who cannot opt out of Medicare. This applies to doctors of chiropractic, as well as physical therapists and occupational therapists in private practice. Medicare rules can be confusing, as we know. So my disclaimer is, even in the process of fact-checking and double-checking what I wanted to say here, which I did research directly with CMS, but in the process I found incorrect and confusing answers from a few surprising sources. So I recommend getting your information directly from CMS whenever possible. And also, this is not 100% of everything you need to know about Medicare. It's possible there are things I have left out, and I am not CMS. But I'm going to do my best to explain the rules as they apply to these providers and what you can do in a way that is concise and understandable and not totally dry, hopefully. Let me know how I do. Since I was asked this question by a chiropractor, I'm going to be framing this answer for a DC, but this applies to those providers who can't opt out of Medicare, and also really the rules for any participating provider are the same. Okay, so rule number 1 is that a chiropractor must be enrolled with Medicare. This means that these specialists must be authorized by Medicare to treat Medicare patients, but you can be participating as in-network or non-participating, which is like being out of network. So basically, your options when it comes to Medicare are to see no Medicare beneficiaries, to see Medicare patients as a participating provider, or to see them as a non-participating provider. So let's look at each one of these, what it means, and how to go about them. So 1, you can see no Medicare patients. You can refuse to see any Medicare beneficiary patients. If you're going to go this way to be fully compliant, it means letting patients know that you do not treat Medicare beneficiary patients for any Medicare covered services. And there's no gray area. It doesn't mean seeing Medicare eligible patients and just not filing claims. Without going into it, this might not be the most recommended option, but it is fully compliant and you can do that. Option 2 is seeing Medicare patients as a participating provider. Covered services for chiropractic are 98940, 98941, and 98942 only. Those are the CMT, chiropractic manipulative treatment, also known as spinal adjustment, and that's it. That's all Medicare covers for a chiropractor. So when I talk about covered services, that's what I'm referring to. Non-covered services for chiropractic are all services otherwise that a chiropractor might do. Chiropractors are not required to bill Medicare for things like physical therapy codes, x-rays, office visits, nutrition, traction, orthopedic devices, anything else that a DC might do other than spinal adjustments do not have to be billed to Medicare. They can be billed to Medicare, and a chiropractor may want to bill those to Medicare in order to get the Medicare denial and have it pass on to a patient's secondary insurance. For participating DCs, the rules are a DC must file a claim for the CMT, covered services, if the patient requests it. A DC can limit the number of Medicare patients they accept into their practice. If you set, for example, an annual limit to the number of Medicare patients you accept, after you reach that limit, you revert to option 1. You can then not see any more Medicare beneficiary patients or treat them for Medicare covered services. You cannot just see them and not bill Medicare. Next, as a participating chiropractor, the DC must accept assignment, meaning the provider accepts the full amount that Medicare allows as payment for Medicare covered services. They must submit claims to Medicare, and Medicare pays the doctor directly. You need to have the Medicare patient sign an ABN form. This is an advanced beneficiary notice. This is mandatory when the provider expects that a service that's normally covered by Medicare will be denied as not medically necessary. When the treatment is for maintenance care, for example, this applies. An ABN is not mandatory for Medicare non-covered services. When services that Medicare never covers are being performed, it's not actually recommended to use an ABN form for this, but you should have a form which can be a notice of financial responsibility on your own letterhead, describing the patient's financial responsibility for Medicare non-covered services. And that includes all the services that Medicare never covers, letting the patient know in writing that they are financially responsible for those things. Then, with the patient fully informed and the information documented, you can charge your patient upfront the amount that Medicare would pay for CMT if it's maintenance care, and you can charge your patient for the services that Medicare doesn't cover. If a patient has deductible due, the DC must collect the Medicare allowed amount from the patient until deductible is met. If the deductible is met, the DC must collect the 20% copay from the Medicare patient and then be paid the remainder from Medicare. A participating provider cannot charge a patient more than the amount that Medicare would pay for Medicare covered services. And then a Medicare participating provider may need to also bill the patient's secondary insurance if they're participating with that secondary insurance plan. If not, you can provide the patient with a bill or a receipt which they can use to get reimbursed on their own from their secondary. Okay, now the rules for non-participating providers. Being non-par with Medicare means that you have signed up with Medicare, you are enrolled, and you can treat Medicare patients, but there are some differences. Like I said in the beginning, you can't opt out, but you can be non-par or out of network. So here's how that typically works. The main difference as a non-par provider is that you do not have to accept assignment, meaning you don't have to accept Medicare's approved amount for the services they cover. Non-par providers can charge up to, I'm going to say 15%. Check your state because it's possible that it's different in some states, but typically it's 15% more than Medicare's allowed amount, basically, that you can charge your patients when you're non-participating. Non-par providers must still bill Medicare for covered services, and Medicare will reimburse the patient for 80% of that. So if you are non-par, get your payment up front from your patient, because the other difference to note is that Medicare will typically not pay the non-par provider directly. So the provider, knowing what Medicare would pay and what they can charge, would charge the patient up front, send the bill, and then the patient would receive reimbursement from Medicare for 80% of the non-participating rate, not the full amount they were charged. In other words, Medicare patients owe 20% of their care and Medicare pays the other 80%. In the case of a non-par provider, if you charge 15% more than what Medicare allows, the patient is responsible for that. Medicare reimburses them 80% of the non-par rate. A non-par provider has to abide by all the other rules and limitations that a participating provider does. Everything else I stated earlier applies to non-par providers. And just to review those quickly, for a DC, CMT is the only covered service. Filing a Medicare claim for covered services is mandatory if the patient requests it. An ABN form should be signed by the patient when they're receiving covered services that may not be reimbursed for maintenance care, or you otherwise expect that Medicare may not reimburse them. A notification of financial responsibility should be given to the patient so that they know that they are fully and directly responsible for payment of any Medicare non-covered services they receive. Medicare patients still need to pay their deductible when receiving services from non-par providers. So the non-par provider is going to want to verify the Medicare patient's benefits so that they can be aware of what reimbursement they might or might not receive from Medicare. And finally, a Medicare non-participating DC does not need to bill the patient's secondary insurance if they are not participating with that secondary insurance plan. The patient can get the reimbursement on their own from their secondary. That was a lot of information. Check us out at orionbilling.com. Feel free to contact me if you have any questions. Have a great day.